One of the hardest things for families to understand after an ICU stay is why recovery remains difficult even after a patient survives respiratory failure. Families often ask, if the lungs are better, now why is my loved one still so weak? Well, this is one of the most important conversations we need to have in critical care medicine. Hello everybody, my name is Madeline Strittmatter. I am a pulmonary, critical care, and sleep specialist. Today I want to talk to you about respiratory failure, mechanical ventilation, and why recovery after severe lung disease can take weeks to months or longer. Respiratory failure occurs when the lungs can no longer adequately exchange the blood or remove carbon dioxide effectively. This can happen from many different diseases. Some of the most common include pneumonia, COPD, chronic obstructive pulmonary disease, exacerbations, asthma, pulmonary fibrosis, ARDS, heart failure, flu, and COVID-19. When patients become critically ill from lung disease, they may require ICU level support, including high flow oxygen, BiPAP, or mechanical ventilation. Mechanical ventilation can be life-saving, but it also represents a very severe level of illness. And I think families sometimes underestimate how critical ill a patient truly is once they require a breathing tube and a ventilator support. Patients with respiratory failure often experience profound inflammation throughout the body. Their oxygen levels may remain dangerously low for prolonged periods. Some require deep sedation, paralytics. Some remain on ventilators for days to weeks. It all just depends on the severity. And during this time, the body experiences an enormous physiological stress. Muscle loss during critical illness can happen very quickly. This includes not only arm and leg muscle, but also respiratory muscles involved in breathing. This is one of the reasons patients may remain weak or short of breath long after leaving the ICU. Another major issue is deconditioning. Even healthy individuals lose strength rapidly with prolonged bed rest. Now imagine addition of severe inflammation, infection, hypoxia, low oxygen state, malnutrition, sedation, organ dysfunction on top of all of that. So recovery becomes much more complicated at that point. Many patients recover from respiratory failure, continue to experience shortness of breath, fatigue, exercise intolerance, anxiety, sleep disturbances, brain fog, emotional stress. And this can be frightening for patients who expected to feel normal quickly after discharge. Some patients may require oxygen temporarily after discharge. Others may need pulmonary rehab. Some require physical therapy, nutritional support, or close pulmonary follow-up. This is essential. And emotionally, many patients struggle after surviving respiratory failure. Being unable to breathe is traumatic. Mechanical ventilation is traumatic. ICU delirium and sedation can create frightening memories or confusion. And many patients experience anxiety or PTSD symptoms after an ICU stay. I think it's important for families to understand that healing after respiratory failure involves much more than oxygen numbers improving. The lungs may improve before the body fully recovers from the ICU hospitalization. And healing takes time. One thing I often tell families is this: the body remembers critical illness even after the crisis ends. And this is why follow-up care matters so much. Patients recover from severe lung disease. They need continued monitoring, pulmonary rehab or some form of rehab, medication optimization, nutritional support, and emotional support. Another important topic is mortality and long-term outcomes. Severe respiratory failure carries significant risks, especially in older patients and those with multiple medical conditions. But outcomes vary tremendously. Some patients recover extremely well, Others experience chronic limitations, and some develop long-term pulmonary complications. So, this is why individualized follow-up is essential, and this is why patients' education matter as well as families, because families deserve to understand both the severity of the critical illness and the reality of recovery afterwards. My goal in this channel is not to create fear, but to create understanding and empowering you through education and know what to expect. You're not alone. I want to help families feel more informed, less alone, and more prepared for the recovery journey after critical illness. Thank you for watching and being here. Please share if it has helped you or you know of someone that is in the ICU and this could help them. Thank you, and I'll see you in the next video.